You can go intra-articularly. We use it for hair, we use it for skin. I'll show you some of the results. Okay, this is an important slide, as in when injecting, these are basically RSTLs or resting skin tension lines. In aesthetics, usually patients come for facial rejuvenation, scar rejuvenation. What we need to do is bring the scars towards the RSTLs. So you need to inject on the RSTLs, so it pulls the scar towards them. The wrinkles disappear. Okay, this is again the forehead. This is, if you want, you can mix it with a filler, or you can mix it. Yeah, you can see some of the improvement in the facial, in the texture, in the skin. Again, for turkey neck, a lot of people come to me for this because usually this is a little bit difficult to treat. So we treat a lot of neck patients. This is about 3 treatments. Breast, non-surgical. People want a non-surgical breast lift. We do it. We also combine it with fat. Sometimes we put some fat in and do it along with while doing fat transfer. It increases the viability of the fat. Again, you can see for under eye dark circles or under eye bags, forehead wrinkles. Again, small wrinkles under the eyes. Again, under eye or tear trough rejuvenation, as it's called. This is a full face rejuvenation. We also do it for vaginal tightening, especially if the woman has a couple of children and she wants a non-surgical procedure. So we inject on the labia majora and the labia minora, and you can see it's approximated. For stretch marks, it has good results in stretch marks. This is, of course, at this time you are not doing PRP2X. This was a plain PRP case. You can see it's ulcers healing, granulation tissue starts to be formed. We use it in wound healing a lot, especially diabetic ulcers, because at the site you need regeneration, you need stem cell, you need growth factor. So this brings the body's own concentrated growth factor over there and helps tissue form. It helps new skin cells form. We also use it for hair. In hair, it's a very interesting thing. A lot of people ask me, okay, I am completely bald, will I get new hair? It's a question that usually people ask me a lot. So I tell them, see, when treating hair, it's important for us to scan the head with a folliscope or a dermatoscope and see hair follicles. Because a hair follicle is a pilosebaceous unit which has the blood supply, it has the nerve root, and it has the hair follicle which has stem cells around it. Now, as a person has hair loss or balding, in a male pattern baldness or in telogen effluvium, what happens is that the stem cells around the follicle start to shrink. These stem cells die. So there is miniaturization. Miniaturization means what? The hair starts becoming thinner, it starts becoming smaller. This is the right time to treat. At this time, if you give PRP, definitely he will get new hair because the follicles are living. From one follicle, you can have 2 or 3 new hairs coming out, but you cannot grow a new follicle. Even with stem cell, you cannot grow a new follicle because stem cell research has advanced to a point where we can grow skin, but we cannot differentiate skin stem cells from hair stem cells in the lab. So if a person doesn't have follicles, the only good thing for him to do is a hair transplant. But as in a transplant, we know there is some amount of fallout. All the grafts do not survive. So we usually do PRP before a transplant to vascularize the bed. So the bed is vascular, the bed is rich, and the new grafts which are implanted start to grow. and you have a minimal fallout of grafts. So the more graft survival time increases. Now, of course, we check for infectious diseases and all, endotoxins, infectious diseases, HIV, HBS, AG before processing the blood. It's autologous, so it shouldn't be a matter, but as of GMP guidelines, you need to check. So what are the advantages of PRP2X or PRP2X Lysate over normal PRP? This is a higher concentration, 10 times the high concentration growth factors. Storage is possible up to 6 months. Multiple doses can be given based on the physician. Safety is ensured in the protocol. What are the contraindications? Usually there are not many contraindications. There are some relative and some absolute. Platelet dysfunction syndrome, clinical thrombocytopenia, hemodynamic instability, autoimmune disease. Now, autoimmune disease is a question mark because sometimes they say PRP helps, RA joints, sometimes it gets worse. So it's a question mark, it has not been studied yet. Obviously, sepsis, liver pathologies, you cannot use PRP. Coagulation therapy, if the patient is on aspirin, warfarin, you need to stop it for some time. You stop it for at least 48 hours and then you can go others, you may have a lot of bleeding. And these are some of the references of PRP from PubMed. So if there are any questions, please do email me or please can ask me questions. We have I think 9 minutes more.
So, with PRP, a lot of it depends on the patient. The underlying science, utilizing growth factors for indication, of course, be studied and be proven. But I think it relies a lot on the patient condition. And a paper came last year in the New England, the English medicine, this English Athletic Medicine Journal.
New England.
Yes, and they compared PRP with saline injection, and they found it's the same result. Okay. You saw the study?
Yeah. See, the study was done PRP with PRP with saline. If you say looking at facial rejuvenation, the immediate facial rejuvenation happens from trauma. Even the injection, at the site of injection, can cause collagen regeneration. But what PRP does, PRP is a long term. You see the actual effects of PRP 6 months down the line, 7 months down the line, where the growth factors actually act. In 3-4 days, the glow you get, it's absolutely the same as normal saline. You inject normal saline, you inject anything, even inject air. There's a paper on air dissection, where they inject oxygen. I mean, it's the act of putting the needle in the skin causes collagen to remodel, because collagen remodels on injury basically. You can have heat injury, which is RF, you can have light injury, which is laser or IPL, you can have electromagnetic injury, or you can have the needle injury. So if it's a long-term study and PRP injected in the joints proves that the cartilage, MRIs have shown, we have MRI showing that the cartilage is regenerating. The dying cartilage is remaining the same. So if you inject saline in the joint, you're not going to get much of a result. On the face, absolutely, it's definitely the same. So that tells that PRP is actually better than injecting plain saline because of. Any other questions?
Thank you, Dr. Rebello. I think all of us enjoyed that talk. Our next speaker.